Before I begin, I want to make something really clear. This video is not about discrediting doctors or accusing anyone of wrongdoing. I have a deep respect for the surgeons, physicians, and nurses who cared for me. They are highly skilled and did everything they could based on the information they had. But this is my experience. What you're about to see is my real medical journey, which was filmed for a TV show. A rare diagnosis, an unusual tumour, and a lot of unanswered questions. And I believe it's important to show how even in advanced medical systems, something very real and very ancient, parasites, can be completely overlooked. As we go through the footage, I'll pause at certain points and explain how what you're seeing could be consistent with a parasite nest. This isn't just a theory. It's based on published research, clinical patterns, and what we now know about how some parasites can mimic or even cause diseases like LAM. This video is for anyone who's been told, it's rare, we don't know, it's a genetic mistake, and especially for those living with unexplained symptoms or LAM. Let's take a closer look together.
G'day, this is Erin. We've just picked her up from Air Ambulance. She's been flown down from Port Macquarie for treatment for her LAM's disease.
Yep.
It's a fairly rare condition. Apparently the flight sister was telling me only 2 or 3 in a million.
Yeah, it's Lymphangioleiomyomatosis.
Yeah. Currently she's in significant pain upon any sort of movement to the left side, going down the rectosternal area as well. Being good en route, but upon any movement, upon rolling over to get the board under, she will yell and scream, but that's the norm for her. So we've been told. So.
All right, on 3. 1, 2, 3.
Sorry.
Yeah.
That's it. Okay, no more. Okay. Breathe deep.
Okay, ready?
1, 2, 3. Thank you very much. Lovely.
I have been through multiple hospitalizations where my pain has been severely misunderstood and mismanaged, despite clear signs of distress and physical symptoms. At my first hospital in Port Macquarie, nurses were shocked by the amount of morphine I had been given, yet I was still screaming in agony. They could not understand why the medications weren't working. Later in Sydney, after my surgery to have the tumour removed, the mental health assessment team was brought into the ICU because I was still screaming in pain post-surgery. I tried to explain that it felt like I had a knife moving around in my stomach. Instead of addressing the pain, they considered giving me antipsychotic medicines, suggesting they thought my agony was psychological. More recently last year, during my hospital stay for the chyle leak, which involved the chest tube, I experienced extreme pain during and after every procedure involving the tube. And despite this, I was still not believed. The hospital called in the drug and alcohol team to counsel me, suspecting that I was seeking more pain medication to abuse, when in fact I was simply in unbearable pain. I am not on pain medication now. I wasn't addicted, I was suffering. I was likely infected with multiple parasites, including lymphatic filariasis, Wuchereria bancrofti, Toxoplasma gondii, and possibly other species. These parasites are known to cause chronic neuropathic and inflammatory pain. Parasites invade and inflame nerves, lymphatic vessels, and tissues. This causes neuropathic pain, which opiates do not relieve. Even large doses of morphine, endone, oxycontin, or fentanyl may be ineffective, just like in my case. Parasites like T. gondii alter the GABA and dopamine systems in the brain. They can block or desensitize opioid receptors, making it appear that I'm tolerant or immune to taking painkillers. This is exactly what happened in hospital multiple times over the last 10 years. So when in reality, my pain system is hijacked. Because my pain is invincible and unresponsive to drugs and emotionally overwhelming, I've repeatedly been misjudged as seeking pain medication for the wrong reasons, misdiagnosed with psychological issues, offered psychiatric medications instead of parasite screening, dismissed instead of treated. I can also drink a lot of alcohol and not feel drunk after a lot of beers. But once I stop drinking, even after 2 beers, I experience intense exhaustion and fatigue. And this has also been proven to be parasitic nesting. Parasites feed on alcohol-related sugars, sudden immune rebound and inflammation once alcohol is withdrawn, and liver overload from parasite detox. Neurochemical crashes worsened by T. gondii or other neuroinvasive parasites. So this is not an addiction. It's not a mental illness. This is a biological reality of chronic parasite infections, disrupting my nervous system, immune function, and organ balance. I'm asking to be taken seriously, to be investigated and treated for parasites, not stigmatized, sedated, or ignored.
Aaron,
How are you?
not bad, a bit of pain.
How's the pain?
Yeah, it's sort of when I take a breath, it's still really sore.
Are these your parents?
Yep,
Hi.
it's my dad.
Tamara and Cody. Hi.
That's my wife, Helen.
Hi. So, Erin, I had a look at your CT scan of your lungs, and it does confirm the diagnosis of LAM. It's quite a rare disease. About 1 in 400,000 women develop, for some reason, a disorder in the smooth muscle cells, which is a type of cell in the body. Basically, LAM usually affects you in one of 3 different ways, and unfortunately, you have all of them. So, firstly, and most commonly, it can cause little holes in the lungs and cause some problems with the breathing. So we'll have to keep a very close eye on that. The other way which it can affect you is by causing a leakage of the lymph.
They put the chest drain in, expecting just to drain some fluid, and then it was like over 5 or 6 litres of chyle came out instead. So that's when they were able to diagnose me.
Exactly.
Yeah.
I guess the third way in which it can affect you is by causing tumours, and I know that's what your current problem is.
Yeah.
So just show me where the pain is.
All over my belly.
Yeah.
And it goes around to my back as well.
So LAM can sometimes cause usually benign little tumours in and around the kidneys, which often don't need any treatment at all, but obviously in your case it's causing you so much pain that we need to try and fix it and get rid of it.
What we need.
Is there a chance that the tumour could be cancerous?
There's always the chance that any lump in your body can be cancerous, but cancer tends to look ugly, and yours is a nice, smooth, sausage-shaped mass, which makes it more unlikely to be a cancer.
Okay.
But the important thing is it's causing you pain, and so we've got to get rid of your pain by taking this lump out. LAM, as you've experienced, is an extremely difficult diagnosis to make, and there's probably a lot of people who remain misdiagnosed. Because they present in a vague sort of fashion, and it's a very rare sort of constellation of symptoms and signs. In your situation, because of the way the thing in the tummy looks, we'd actually prefer to cut it out.
Yeah.
In your tummy is pretty impressive because it goes from up underneath your diaphragm, it goes all the way down into the pelvis. The important thing is the lump itself is neither here nor there, but the things that it's near and attached to, the left kidney and the pancreas, and possibly the adrenal gland. The good thing about the pancreas is it's just the tail of the pancreas, but one of the things about the tail of the pancreas is it's very, very close to the spleen, and your spleen might need to be removed. Whilst you'd like to hang on to your kidneys, if we have to take it out, well, then so be it, but you've got a right one. You don't have to alter the way you live. You can actually have a normal diet and drink normally, water or alcohol. And the adrenal gland, once again, lovely to hang on to it, but you've got 2 and you only really need 1. All the things in your guts and things are all pushed forwards by it. So we lift those all to the side or towards the midline, and then we basically take out this large tumour, taking whichever things it's attached to.
Okay.
Morning, Erin. Got to surgery. Yeah, I understand over the weekend you had a chest drain put in. Did Tam organise that?
Yeah. Just because the X-ray showed my lungs were full of fluid, so.
So the fluid had come back.
Yeah.
Okay, and as a result of that chest tube in, you felt a lot better?
Yeah, it drained 2 litres.
2 litres.
Yeah.
We'll do everything possible to preserve your kidney.
Okay.
And the other things we talked about, well, it's a matter of whether the tail of the pancreas is involved, the adrenal gland, and I'll give your family a call as soon as we're finished. Okay?
Thank you.
No worries. So we're just opening up the abdomen to hopefully remove this large lump, which is related to her LAM. Carlo, what do you know about Lymphangioleiomyomatosis?
It's a very rare condition. It's mainly female under 30 years old.
Did you look that up or did you know that sort of stuff?
I remember something from the medical school.
Is that right? Really? I'd never heard of it. The tumour at first sight appears to be very soft, so we'll have to try and keep that intact. The tumour is roughly about 20-something centimetres long disappearing up next to the spleen, and we're able to mobilise it at least away from the bowel so far. I haven't gone behind it to see what's happening with respect to the kidney. Moment that the tumour would appear to be full of blood, which could easily explain why she'd been having some pain, and surrounding the ureter and going up into the kidney. The kidney itself looks all right, so what we're just doing at the moment is trying to find the ureter, which seems to be surrounded by this tumour. The ureter is the main tube that takes urine from the kidney, where it's formed, down to the bladder. I think we'll get rid of this major part of the tumour. It's full of blood. Very clearly been a hemorrhage into it, even though the scan didn't look a lot different. And as I said, there's some solid components, as you can see, that sort of, not, I wouldn't call it hard, but much firmer than the cystic component. And that's now deflated, but inflated. It was about 20 centimetres long. Really, as well as we could have expected, and Erin has kept her left kidney. So we've preserved all the structures we really wanted to preserve. It was next to but not involving the spleen. It was next to but not involving the tail of the pancreas. And I suspect that it has risen from the adrenal gland.
Sorry.
What do you think that tumour was?
It's very difficult to know. It's not something you see very often.
No, it's very different to anything I've ever seen before. It was full of blood. It was fed by vessels coming from around the kidney. The pathologist will have to tell us what it is. So we just got to close the abdomen now. Met you too. All went very well. The important things that were on the top of Erin's mind is, first of all, malignancy. That means, was it cancer or not? It didn't appear to be. So we were able to remove it all.
And what about the kidney? Is
the
okay?
kidney's there.
Cool.
The kidney stays behind.
That's good.
The reason for Erin having pain last week was because the lump was full of blood. The organs we talked about that it was sitting next to, because they're all near the kidney, the spleen was not attached to it at all. It was able to be pushed away, and the tail of the pancreas was able to be pushed away. And the kidney, as I said, was the main sort of concern.
Yeah.
And I was able to take the tumour out. Everything is removed.
So glad you did it.
Okay. Thank you very much.
Yeah.
Lovely to meet you.
Thank you.
Well done.
Thanks very much.
Thanks.
Okay.
I'm going to give you a kiss.
Oh, okay. Kisses are good.
Before we begin, I want to say something important, especially to those who mock or dismiss what I'm about to show you, just because I've used AI to help me explain it. AI isn't magic. It's not fantasy, it's a tool. A tool trained on millions of scientific papers, medical journals, and clinical reports. It doesn't replace evidence, it organises it. It doesn't invent data, it connects it. If a human doctor explained it to you, you'd believe it. But if a machine helps a patient understand their own case better than anyone else has, suddenly it's crazy. No, that's not science. That's fear of change. This isn't a conspiracy theory. It's anatomy. It's immunology. It's parasitology. And I'm using every tool available to uncover the truth about what happened inside my body. This is what medicine is supposed to be: investigation, curiosity, and care.
Hey, Erin.
Hey, how you going?
Good, good. Hello. Hello.
How are you?
I'm good. Good to see you.
Yeah.
No more kissing today. Justin. Hey, Justin. And
Thank
Erin.
you so much.
It's a pleasure, Erin. The tumour looked very benign. Remember we talked about cancers looking ugly?
Yeah, yep.
It didn't look ugly.
Okay.
And which is good.
Yeah.
And it was full of blood, which
Okay.
probably explains why you've had all that pain. The pain's good, not as bad
it's not
today.
too bad. I had it x-rayed this morning, and when I had to lean forward, like, there was a lot of pain, but other than that, it's been okay.
Whether it needs any further treatment that will be due to what the pathologist tells me. Well, let's hope taking the lump out of your tummy is going to decrease the fluid in your lungs.
Excellent. Yeah. Okay.
Now,
Okay.
before we take a closer look at what the surgeon actually found inside my body, I want to explain something important about how I put this together. What you're about to hear is not my interpretation. It's not a guess. I took the entire word-for-word transcript of what my surgeon said before the surgery, during the operation, and after. and I input it into an AI trained on tens of thousands of medical documents, surgical textbooks, parasitology papers, and diagnostic manuals. What came back wasn't vague, it was clear. Every detail, the size, shape, location, texture, the bleeding, the vessels feeding it, the organs pushed aside, the lymphatic pressure, it all matched one known pattern in medical science, a parasitic nest, most likely caused by Wuchereria bancrofti or Brugia malayi. This is not a theory, it's an analysis. The AI didn't inject opinions, it identified biological patterns that fit exactly with what the surgeon saw and said. So now let's take a look line by line at what was really inside me. Not a tumour, not just a benign lump, but a living, bleeding, lymphatic parasite nest that had been growing for years and was mistaken for a rare disease. First, he describes it as a smooth, sausage-shaped mass. That's not cancer language. Cancer is irregular, ugly, invasive. But a sausage-shaped mass, that's classic for lymphatic filarial nests, which form in the long, dilated lymph vessels. These worms physically stretch and fill the lymphatics, causing smooth-walled swellings that can extend for 20 centimetres or more, just like he found. Second, he said the mass is full of blood. Now, why would a benign tumour be full of blood? It wouldn't. But parasite nests are. Why? Because they create lymphatic obstruction, triggering fragile blood vessel growth all around them, a process called angiogenesis. The new vessels rupture easily, which is why filarial nests often hemorrhage. That's the pain I was in. That's the bleeding they found. Third, he says the mass was soft, but with some firmer components. Again, very typical of helminth nests. This soft part is the inflamed, fluid-filled lymphatic tissue. The firmer parts, that could be dead worm bodies, calcified debris, fibrotic tissue from immune attack. It's what happens in chronic filarial infection. Then the location. He says it was wrapped around the ureter near the left kidney, possibly coming from the adrenal gland and pushing everything else, pancreas, spleen, intestines, out of the way. This is prime real estate for Wuchereria bancrofti. These parasites prefer the deep abdominal and pelvic lymphatics, especially near the renal hilum, the peri-aorta nodes and the iliac chain. That's exactly where mine was. He even said the tumour had its own blood supply, vessels feeding in around the kidney. That's classic. Parasite nests hijack blood vessels to stay alive and manipulate the immune system. It's how they mimic tumours. And the biggest clue? He says he's never seen anything like it before, that it didn't look like cancer. And the pathology? Completely benign. That's because it wasn't a tumour. It was alive. It was parasitic, but no one ever checked. This is how misdiagnosis happens. LAM is a label, a description of symptoms, but it doesn't explain the cause. And for me, all the signs and every symptom, every scan, every surgical observation pointed not to a genetic disease, but to a chronic parasitic infection that was overlooked.
Hello.
Hi, Dr. Gallagher.
Hi, I'm back from school holidays.
Nice to see you again.
Yeah, best news is your pathology is completely benign,
Oh, good.
and it doesn't need any more treatment or investigation.
Any idea of how long it's been there or not really? It's hard
Probably
to tell.
years, they think.
Really? Okay.
And so now it's basically, will this make your lungs feel better? I don't know.
Yeah, have to wait and see.
But it's removed, and
Yeah.
it must have been causing some sort of pressure effect.
Yeah.
So you're better off without it.
That's good. Very
And
good.
how are the lungs going?
Yeah, not bad. I had a chest x-ray yesterday. and
Yeah,
there's
I
not-
hadn't heard the result of that
Yeah,
yet.
not too much fluid on there at all.
That's good.
So I'll be going home for hopefully whenever you tell me.
So the answer is you can go home whenever it is you want to go home.
Really? So I could go home today?
You could go home this afternoon if you wanted to.
Oh, that's so exciting.
Oh,
Yeah.
So you've come a long way from when you first
Yeah.
came down to Sydney,
Learned a lot.
where you know more about LAM than most people do now.
Yeah.
So here we are, 8 days after the surgery. The surgeon tells me there's no need for further investigation. But let's stop right there and really think about that. They don't know what the mass was. It was full of blood, wrapped around my lymphatic vessels, pressing against my kidney and ureter, and displacing multiple organs. It wasn't a known tumour. It wasn't cancer. It was labelled benign. But benign doesn't mean harmless. It just means not cancer. Now look what happened after it was removed. My chylothorax, the fluid building up in my lungs, suddenly cleared up. The x-ray showed a dramatic improvement. That's not coincidence. That's cause and effect. Why did the chyle leak stop? Because the parasitic nest was finally removed. Wuchereria bancrofti and Brugia malayi live inside the lymphatic system, clogging and inflaming the delicate vessels that transport lymph and chyle. When those parasites form nests, especially around the retroperitoneum, adrenal glands, kidneys, and cisterna chyli, they block lymph flow, rupture fragile ducts, and cause fluid to back up into the lungs, abdomen, and tissues. Once the obstruction was taken out, the lymphatics began to drain normally again. That's why the fluid cleared. But here's the problem. Because I was already diagnosed with LAM, a disease also tied to lymphatic damage, the system didn't ask any further questions. No parasite testing, no microscopic examination for helminths, no staining for microfilariae. Nothing. It got boxed under LAM, and that meant the investigation ended. But if the lump had really been a LAM-related angiomyopathy, why did removing it suddenly improve my lungs? LAM doesn't resolve like that. Parasite blockages do. This isn't about blaming doctors. I'm deeply grateful for every surgeon, every nurse, every specialist who helped me. Their skill and compassion truly kept me alive, and I truly appreciate them. But the system they work within, the diagnostic guidelines, the medical assumptions, the refusal to consider parasitic disease in so-called developed countries, that's what let me down. And it's letting others down too.
And after her recovery, for the first time, Erin met others facing the same challenges at the LAM Research Alliance.
Yeah, Dr. Gallagher took it out at RPA.
And here's where the proof becomes undeniable. I didn't just tell a story, I uploaded the actual image of the tumour. I entered the exact word-for-word script from my surgeon, what he saw on the scan, what he found during the surgery, what he said after. No interpretation, no guesswork, just raw clinical observation. Then I fed that data into an advanced AI tool designed to analyse complex medical patterns across millions of research sources. And what did it show? That what was removed from my body matches in every measurable way a parasitic nest, consistent with Wuchereria bancrofti and Brugia malayi. This isn't a theory anymore. This is evidence. This is science. This is what happens when we let data speak instead of assumptions, when we stop seeing parasites as a problem for other countries and start realising they're here and they're being misdiagnosed over and over again. AI didn't invent this diagnosis. It revealed it from my real scans, my real surgery, and my real symptoms. This is not about blame. It's about truth. And the truth is, parasites have been overlooked even when they're right in front of us. But this moment, this tumour and this surgery isn't how my story began. And it's certainly not where it ends. There's much more I need to show you. After visiting the Dominican Republic, I developed a strange tumour on my ear, one that looked strikingly like elephantiasis. I still have the photo. It was surgically removed on a remote island in Scotland prior to my LAM diagnosis. But somehow the entire visit, including the operation, was wiped from my medical records. I'll be sharing much more, each testimony adding more evidence to what is already undeniable: parasites cause LAM. That's why it's so disheartening that the LAM Foundation have chosen not to investigate parasites at all. Their response confirmed it. No testing has been done and none will be done. They're not looking, even with all this evidence right in front of them. That silence is why I'm telling this story, because the system may choose not to ask questions, but I will, and I'm just getting started.